Software. I am Dr. Mohammed Chudhary, MSCOO7 version. Welcome to medical science class. As a student of medical science, I wanted to take clever every branch of science. What key to think, say, do, that is birth, that is knowledge, that is this, and that is good work, that is an art. What is medical science? Medical science is the branch of science discussed, elaborated about human creation, like human unique creation. Human scientific name Homo sapiens. You know that, see that eyelid, that is what is that? Medical science student. I have also case patient. What is this? Bleeping. Eyelid infection. Sign of rubor, color, taller, tumor. Rubor, redness, color, temperature, tumor, swelling, dull or loss of function. There is sign of inflammation. In what is that drug? Blepharitis. In case of blepharitis, treatment of choice, antibiotic. In case of treatment of choice, which antibiotic? Any antibiotic, but azithromycin. I use azithromycin. Also other antibiotic, you know that. But still now I not take antibiotic. What is the reason? As a doctor, I try to clean that. Without antibiotic, I can make that cure or not. Okay, fine. I believe my immune system should have capability. By the name of prostate multiple case science for one and only key to that. So don't worry about that. Medical science class, we discussed elaborated about nervous system. In nervous system is elaborated about nervous system. Brain, spinal cord. Central nervous system, brain, spinal cord. Nervous system is divided by two parts. Central nervous system, peripheral nervous system. Central nervous system, brain, spinal cord. Peripheral nervous system, 12 pair cranial nerve, 31 pair spinal nerve. In case of cranial nerve, vagus nerve is exception. Vagus nerve is the exception. Exception is not example. Vagus nerve. Now 31 pair spinal nerve. What is the spinal nerve formation? That was homework. In case of spinal cord, covering meninges. In case of meninges, there is durameter, outside to inward, durameter, araconoid meter, pyometer. In case of CSF remain durameter and araconoid, between durameter and araconoid meter, or pyometer or araconoid meter. Durameter and araconoid meter. See the book. I am also creation, not know the everything. You know that is the proof. See the main book, medical science, Grey Anatomy, Meter Atlas. Also, you know that you see the main book. In case of medicine, Stanley Davidson. I read 20 edition. Also Billion Lab. So other medical book. Main book. Also gynae. Also I read Dutto. You see the main book. As per I know, Dr. Mohammed Chudhary. I am Dr. MSc. I am representative of Dr. Mohammed Chudhary, MSCOO7 version. So my word is spinal nerve formation. From spinal cord there is a ventral root, dorsal. Ventral means in front and dorsal means behind. There is a two root. From column there is a ventral and dorsal. Fine. Ventral root, dorsal root connect to the point. From that point there is a spinal formation of spinal nerve. And spinal nerve in front go to the ventral rami in front, behind dorsal rami. Ventral rami supply the ventral in front side, dorsal rami supply the back side or back muscle. And ventral rami supply the in front muscle. Spinal 31 pair spinal nerve. So why if spinal nerve anyone cut, then nearest nerve transplantation already say autograft or allograft, xenograft. In case of auto, or from accessory nerve you connect repair the spinal nerve by not suturing, repairing. into in, then you can repair that. And you can utilize surgical glue, absorbable surgical glue, and repair that. And into in, from accessory nerve, take nerve and connect that, and repair that. Not only spinal nerve but also cranial nerve, not only cranial nerve but also any nerve. You can repair that by that formula into it. And give vitamin B1, B6, B12, also essential amino acid. Also for glucose supplies is hampered, then glucose, oxygen supply is hampered, then glucose, oxygen. But in case of diabetic patient, you know that the hypoglycemia or hypoglycemia, that is the concern point. See the diabetic patient, hypoglycemic patient to give glucose, hyperglycemic to reduce glucose by insulin. Now my friends and supporter, now you know that I am also case blepharitis. You see that left eye lid infection. Now my friend and supporter, today is spinal nerve, 31 pillar spinal nerve. Also you know that connect nerve, how repair the nerve. Surgeon has fear about nerve, not both vein and artery. What is the reason? If nerve cut, that area, nerve supply hamper and paralysis occur. That is the reason surgeon very much fear about nerve. In case of vein artery, that can be suture, that can be suturing or suture can correct, but in case of nerve cannot suture. So that is dangerous, paralysis, and every surgeon should have fear. So those for remove fearness, now you have no fear. But those are surgeon, professor there. Otherwise, cut the nerve, that repair, that take time. That also not good. Repairing necessary, but the death is the dangerous. So repairing necessary to repair the nerve. By that system, you can repair the nervous system. Now 31 pain spinal nerve, you know that corresponding area supplied there. And because cervical nerve, how much cervical nerve? 31 pain spinal nerve, we calculate 8 cervical nerve, 12 thoracic nerve, 5 lumbar, 5 sacral, total 30, and 1 coccygeal. Total 31 pair spinal nerve with comb. In case of coccyx, foramen. In case of sacrum, sacral foramen. Okay, fine. And sacrum is fused. There is a sacrum vertebra fused together and form sacrum. Okay, fine. In adult human. Now nervous system, you know that nervous system efferent. In nervous system, peripheral nervous system, somatic, central nervous system, central nervous system, brain, include brain, spinal cord. And peripheral nervous system, or 12 pair cranial nerve, 31 pair spinal nerve. In case of peripheral nervous system, 12 pair cranial nerve, 31 pair spinal nerve. And now you know that in peripheral nervous system, have peripheral nervous system have peripheral nervous system, somatic autonomy. Soma means muscle, supply the peripheral nervous system muscle, that is somatic. Somatic nerve fiber. Autonomic, that is supply the organ. Autonomic, sympathetic, parasympathetic. In parasympathetic supply, we know that heart, lung, organ, vagus nerve. In case of sympathetic purpose, corresponding vertebra, that organ corresponding vertebra, then supply that thoracic, sympathetic supply. In case of somatic, soma means muscle, limb, supply autonomic. And efferent fiber. Efferent fiber, how it happen? Sense, efferent fiber take the sense from limb to brain. Efferent fiber, sensory fiber, take the sense from limb to center, and efferent fiber center to response center comes center to periphery by efferent fiber. And for example, if I give fine, for example, I hit sensory fiber, sense carry efferent fiber to brain, and efferent fiber what do find heat apply, take away, just like that, for example. Thank you very much, my friend supporter. Today is an up for medical science class. I am Dr. Mohammad Sohel Choudhury, MSCOO7 version, representative of Dr. Mohammad Sohel Choudhury, MSCOO7 version Sohel, and by Bangladesh BMTC Medical and Dental Council by my registration number. As a patient, you should have right to know my registration. Any doctor, my registered doctor will know. My registration number 75,995. Bangladesh Medical and Dental Council, Dr. Mohammad Sohel Choudhury, MSCOO7 version Sohel. And complete Dr. Mohammad Sohel Choudhury. You also know that what an institution. My institution is Holy Family Red Crescent Medical College, and not regularly, irregularly. You know that regular batch, irregularly. Complete 5-year course, complete equal more or less 10 years. So I am Dr. Mohammad Sohel Choudhury, MSCOO7 version, and Sohel, Dr. Mohammad Sohel Choudhury, registration number 75,995. Okay, fine. How much patient remain? Allah Shafi, Allah Mafi, Allah Kafi. By the help of constant multiple gas pool, science pool, one and only equatory, Allah can alive. Medical physics, for medical physics, medical chemistry, is it possible? Yes. Okay, my friend, medical physics, yeah, ya Kudusu yallah, Abdul Kudus, ya Wadudu yallah, Abdul Wadu. In case of those patient, dead patient alive, that is say, yeah, that is also cured with you. Ya Muhi yallah, Abdul Muhi can alive patient by the help of constant multiple gas pool, science pool, and equatory. If anyone disturb me, hurt me, kill me, what's my friend? Now, Ya Mumi to Yallah, Abdul Mumi can take away life. That is called Ya Mumi to Yallah, Abdul Mumi. Creator can give life, can take away life. As a creation, if Creator give me a right, those are good, give them life back. Those are bad, take away their life from the body, or separate the life from the body, and they will be die. Why you try to hurt me, kill me, beat me without negligence? I hurt you, beat you, kill you without negligence. Or say my friend, am I good doctor, bad doctor, or ugly doctor? Those are try to hit me, beat me, kill me. Can I give their death punishment? I should have right to give them death punishment? Write down in my comment box. Thank you very much, my friend. Today is enough.